How safe take deworming medicines? Question arises because of the doctors keep advising to take deworming tablets, especially among the children, at least once in 6 months. Generally prescribed medicines are albendazole, some mebendazole, as well as the ivermectin. We actually need these medicines or not. For worm infestations, the worms enter our body in the form of eggs. The eggs, they enter into the intestine, and in the intestine these eggs latches into the parasite, that is the so the worms start living in our intestine. So once they are in the intestine, they start consuming the nutrients of our food. So the patient who got infested with these worms will be having the symptoms like pain abdomen, nausea, vomiting, and loss of appetite, so bloating of abdomen, fatigue, mainly because these worms will be the most of the nutrients that we consume, so because of which we will be having, the patient will be having the fatigue, generalized weakness, as well as the most common is the anemia, iron deficiency. Prescribed for this infection is albendazole, mebendazole, or ivermectin. It is good to take these medicines if you are infected or infested with these worms. So, but let us see what are the chances of getting this infestation. The eggs enter our body. The eggs enter our body from the soil. One thing is from the soil. Second is from eating raw meat. Third thing is from eating the raw vegetables. Is the soil which is being contaminated with infected human feces will be having the eggs of these parasites. Second, the children's playing in the soil which is being contaminated with the feces of infected person, as well as the barefoot walking in such a contaminated soil, these people may carry these eggs into their body. Second thing is eating raw meat, especially the pork or beef meat, the person may get infected. Third thing is eating the raw vegetables. Second, the raw vegetables which are grown using a sewage water, the sewage water will carry these eggs, and such a person, the person who is eating the raw vegetables which are grown using the sewage water, may get infected with the worms. The first possibility of getting infection from the soil. Yes, children will be playing the indoor games. We have not seen the children playing in the soil. So one thing. Second thing is even the barefoot walking. Nobody will be doing this barefoot walking in the soil. People will be using the expensive shoes. That how the soil gets these eggs, it is from the infected human feces. That is again when the defecation is being done outside defecation, when defecation is done in the soil, in the open space, such a soil gets contaminated with these eggs. Again, this is nowadays this is not being seen. Almost every village will be having, every house, every village will be having the toilets. So again, there is no contamination. First possibility of a contamination of soil with this egg is highly impossible. Possibility is through the raw meat. No one eats a raw meat. Even simple boiling for 5 or 10 minutes is eggs. So again, there is no possibility of getting this infection, worm infestation from the raw meat. Third thing is from the vegetables. Vegetables which are being grown using a. Second, we can getting the infection, worm infestation from the vegetables. So by avoiding such vegetables, one thing. Second thing is cleaning these vegetables using warm water. Third thing is by removing the outermost layer of these vegetables, will also remove these eggs, and also by boiling this of eating, instead of giving the raw vegetables, giving a boiled vegetables also prevents getting this infection. Medicine safe. So whatever the medicines which are being given, like albendazole, mebendazole, ivermectin, are they safe? Generally, they say that the companies say that they are the safest medicine, but no medicine is safe. When they say safety, it is only for the acute complications. So, but definitely the medicines will have long-term complications. The long-term complications of deworming agents could be, it may affect the heart, it may affect the nerves, as well as it may result in chronic skin allergies. Actually, no worms, no eggs of worms are entering our body. So it's not wise to take these deworming agents. Have a precise and scientific knowledge of health and medicine, then only you subscribe to our channel. Thank you.